My name is Nicole, and by day I am a groom here at World Horse Welfare's Glenderspooner Farm. I'm extremely lucky that within this series of Horses Explained, I get to speak to some professionals about their area of expertise, all around what makes up a horse. In today's episode, we're going to be speaking with our vet, Stuart Altoft, who is an advanced dentistry practitioner, about teeth, and then we'll be speaking with Simon Daniels, an equine scientist, about the digestive system of a horse. I'm extremely excited about this. Let's get going. So Stuart, thank you so much for joining us. In this episode, we're going to be talking about the digestive system. I feel like it would be silly of me to not ask you about horses' teeth. So what is special about horses' teeth?
Well, horses have quite different dentition compared to humans and dogs and cats that we would be used to, where our teeth are completely covered by an enamel, which we use for grinding down food. Because horses have evolved to live on a very harsh, fibrous food, their teeth are constantly being worn down. If they had similar teeth to us, those teeth would very quickly be worn down to nothing. So they have evolved, along with cows and deer and some species of rhino, what's called a hypsodont system, which basically means a long crown. They've got a very, very long tooth, unlike rabbits and rodents, which continually grow their teeth. Horses develop a very, very long tooth, which slowly erupts over time. This is an example of a young horse, which shows it really nicely. Because of the length of the teeth, there isn't enough room in the bottom of the jaw, and so he's actually had to grow a little bit of extra jaw just to accommodate it, which is why young horses have these tooth bumps on the bottom.
Okay, and so their teeth are always part of their anatomy, and then over time they gradually erupt, and it's not that they're growing as they go.
Yes, they don't grow new teeth or a continuous tooth. That tooth just works its way slowly out, hopefully in at the same time or in the same proportions as it's been worn down.
And is the wearing down of their teeth quite even, or does that happen at different stages? Are some of them more susceptible than others?
So in an ideal world, it's very even, particularly if you've got a horse with good dental conformation. Unfortunately, we as humans over the years have bred horses for various functions, and we bred them quite a long way in some cases from what is natural and what they evolved to, and we've done that without often paying a lot of attention to their teeth. So we bred in some conformational abnormalities, and so wherever we've got teeth that don't quite match, those teeth won't wear, but will still continue to erupt through, and that can leave us with large overgrowths and other problems. The other thing that we find with horses is that there's a mismatch between the lower and the upper jaw. So the lower jaw is quite a lot narrower than the upper jaw, and when their teeth are aligned in the midline, those upper and lower teeth don't meet. It's only really when they chew from side to side that those teeth come into wear. And so if the horse isn't chewing far enough across its mouth, we'll talk about what feeding might affect that. We find that the edges of the teeth, usually on the outside of the upper teeth, on the inside of the lower teeth, don't get worn down, and that's where horses will produce these classic sharp enamel points that we think about when we're talking about rasping teeth.
Yes.
And the normal routine dental care that we do.
Okay, and so in terms of day-to-day management, why is it important that we consider how their teeth are growing?
So the key thing in terms of our normal management really is about how we feed them. So horses have evolved to really eat a very rough, fibrous diet, and oddly that includes grass. We think grass has been quite soft, but it's got quite a lot of silicates in it, which are a very abrasive substance. And the more fibrous material a horse is eating for their teeth, but also this goes on to talk about gut health, stomach health, all of those other things. But the more fibrous material they're eating, the more they have to chew and the more they have to move their jaw all the way across to get a full grinding surface, and we get less of the overgrowths. With horses that are eating a lot of concentrated food, they don't require that same chewing pattern, and those horses tend to develop more overgrowth and more problems.
Okay, so the benefits of feeding a forage-based diet are considerably high.
Yes, absolutely. Yes, much more natural. I tend to take a fairly simple approach to nutrition, and just feel that the more natural we can make it, the better, really.
No, that makes a lot of sense. It's what would happen out in the wild, and if that's what is able to promote healthy dentistry amongst our horses, then why would we change that?
Yeah, absolutely.
And so this leads us on nicely to the digestive system. How do our horses' teeth work and link in with that system?
So what's key, horses are hindgut fermenters. They do a lot of their digestion. A lot of their digestion is reliant on bacterial digestion, and in order to achieve that, they've got to break this fibre down into very small, usually sort of 4 to 5 millimetre length sections. Otherwise, it will simply just work its way through. They can still eat it. So horses that have got poor teeth, potentially as they get older and their teeth start to wear out. One of the downsides of having a fixed amount of tooth is that when you get into your late 20s, that tooth runs out. Those horses are still able to eat that fibre, but they're not able to digest it because they're not breaking it down enough already.
So what can we do as horse owners to ensure that we are looking after our horses' teeth as best we can? How often should we be getting them checked?
Well, the first thing we talked about obviously is feeding them as natural a diet as possible, and with those older horses that we talked about, if they're not able to chew fibre up anymore, those are the ones that we need to start thinking about feeding them potentially an already milled fibre diet that's already broken down for them. In terms of our sort of care as horse owners, obviously keeping a very close eye on what the horse is doing. Horses are extremely stoic, particularly when it comes to dental pain and mouth pain. And we know that horses are very capable of chewing on one side of their mouth, and so they won't always make it completely obvious if they do have a problem. So having them regularly checked, either, in my opinion, either by a vet or by a BADT qualified dental technician, is absolutely essential. Depending on their age, health and what sort of work they do, that's anywhere from sort of 6 monthly to a year. And we're looking out for any signs that they might be uncomfortable. And sometimes that will be, if they're a ridden horse, sometimes that will be signs that they're not comfortable on the bit or during work. The classic sign of oral pain in the horse is what we call quidding, which is dropping or spitting out half-chewed clumps of hay, really. Horses are not designed, unlike cows, they're not designed to chew the cud. They're supposed to chew it once and swallow it. And so if you're getting constant chewing, if you're getting pouching of food in the side of the mouth or spitting it out half-chewed, that's usually an indication of pain somewhere. And that can range from loose and broken teeth. It can range, we often see gaps develop between the teeth where food can get trapped and cause periodontal disease, gum disease, which is a very painful condition. Or sometimes we'll even see it simply with overgrowths if the jaw isn't able to move properly because we've got bits of teeth that are too large and are restricting how well that jaw can either move side to side or front to back. That can also cause problems.
And am I right in saying that where those gaps can form is then where we're susceptible to getting diastemas within our horses' mouths?
Yeah, absolutely. So diastema is that gap, and that's quite a common problem that we see, and probably the most common cause, I would say, of quidding or dental pain.
Okay, no, that makes a lot of sense.
And that can lead, obviously, if you get any sort of persistent infection, particularly if you've got food trapped in between the teeth, that can lead fairly quickly to starting to get infections that can run down through the periodontal ligament of the tooth and create loose or painful teeth, or even worse, a tooth root infection.
Okay, and then that's often where we see sort of enlargements in the horse's face where they've got a significant infection or...
Yeah, absolutely. And unfortunately, in most cases, that then requires the tooth to be extracted, which is these days is done usually through the mouth under sedation with a local anaesthetic, but it's a long procedure, and if we can avoid that, that's obviously much better.
For sure, and I think the key message is that it's so important to have your horse's teeth regularly checked, whether that's on a 6-month or yearly basis, you know, in liaison with your vet or dentist,
Yep.
and then we can prevent these then more severe, more intricate operations or surgeries that they need to have.
Absolutely, and I think that regular check is the key thing. I mean, we're all supposed to go to the dentist every 6 months, and if we walk in and have a 6-month check and get told everything's fine and you don't need any work doing, you're absolutely thrilled. So there's no reason why we shouldn't be doing that for our horses, and hopefully that they don't necessarily need treating every 6 months, but we ought to be looking at them. In my hands, that would be done under just a light sedation, but that just allows us to go round the whole mouth with a very powerful light and a mirror, or even the dental camera, and just have a really close-up look at all of those teeth.
And by giving them that light sedation, that means that we can provide a sort of like a comfortable, less stressful environment and experience for them?
Yes, absolutely. It's perfectly possible to do a routine rasp treatment without sedation, and there's a lot of EDTs doing that, but I find, in particular with the horses that we deal with at the Horse Welfare, we find that that sedation just brings that stress level down and just makes the whole thing a little bit more comfortable, and certainly it makes it easier to do a very detailed examination.
Yeah, and that's what we want.
Yeah.
No, that's perfect. Thank you so much for letting me pick your brains on this, and I think it's going to lead on nicely into our next segment about the digestive system.
You're very welcome. Thank you.
So we've already been joined by our vet Stuart, who has explained to us about teeth in relation to the digestive system. What makes up the digestive system, Simon?
Okay, so the horse's digestive system is slightly similar to ours, but we refer to them as a hindgut fermenter. So at the front end, if you've already discussed the teeth, you then have the esophagus down to the stomach, which is underneath lots of other organs. So you can see here, we've got hearts and lungs. And then we have a small intestine, about 20 meters of small intestine. And that's all the foregut. But then the horse has a hindgut, similar to us, but it's a much larger proportion. So the horse has a caecum, and the caecum would be like the equivalent of our appendix. Okay. But our appendix is tiny and we don't really need it, whereas the horse's caecum can have a 36-litre capacity, is about 1 metre long, and is a huge fermentation chamber. And then the rest of the hindgut is made up of the large colon, which is made up of 2 portions, a dorsal and a ventral portion, so a bit closer to the back and a bit further away. And again, that's another fermentation area, and that can be another 60 to 80 litres of capacity. So if you compared the horse's digestive system to ours, it has a much more of a focus on the hindgut anatomy and less a focus on the foregut anatomy, because that's where most of the digestion really is going on with the horse. Its fibre diet is very much focused at the hindgut, and it makes up quite a lot of the horse's weight, because
yes,
you can see on our model here that in actual fact there's a lot of anatomy cramped into, with all the other internal organs, quite a small space.
For sure, and it's really helpful to be able to see it tangibly. So we're lucky that Bailey's Feeds have loaned us their rug on our appropriately named pony Bailey. It wasn't intended, and so it's great to be able to see it in person. You've mentioned about the caecum. What other differences are there for human digestive systems and horses? So
the horse has a simple stomach in the same way that we do, unlike its ruminant co-parts. So unlike a cow that has multiple parts, the horse has got one like we do, but they have a slightly delicate composition. So the lower part of the stomach is designed for enzymatic digestion. That's where it starts to digest protein. And then we now understand that there is a bit of fermentation in the upper part of the stomach, but there's a line that runs around the middle, and it's got a funny name. It's called the margo plicatus, and that's the area that we quite often see gastric ulcers and splash ulcers, because above the line the horse has no protection from the gastric juice, whereas below the line its stomach is designed to cope with the gastric juice. And the idea is that the food is continually trickling in and there's always a mat sitting on the top, and so that stops the splashing. But depending on how we manage our horses and their diets, that doesn't always work, or when they're exercising you can get a bit of splashing. So that's one difference, where they've got this non-protected area in the upper portion of the stomach. Their digestive system is a wonderful thing, but also quite a poor design. So the small intestine only has a couple of points where it's attached, and everything else, all the loops that are in there, they're not totally free. They've got this lovely sort of mesentery layer which has all the blood vessels that go through, but that sometimes means that they can slop through into places that they shouldn't, which isn't the best design. But they have a good small intestine. It's long, it's about 20 meters, but it's not very efficient at digesting cereal grains, starches. So things like our barley, oats, wheat, maize, depending on how they're processed, they don't have as much enzymatic activity as we do. And then, on the flip side, they have the huge hindgut. So we don't eat lots of grass. We probably don't eat as much salad as we should do, but in a way, when we're eating those fibrous things, they will be fermented in our equivalent of our hindgut, our large colon. But in the horse, there's a lot of fermentation. A huge amount occurs in that caecum that I mentioned, and then in the large colon. And with the caecum, you'll find that that's a really fibre-focused area. Okay. So the bacteria don't like lots of changes in the pH. So if the wrong type of food gets too far back, that's an area that gets upset really easily.
And what happens if that area does get upset? What can happen?
So in the mildest sense, if we get some changes in the bacterial ecosystem in the caecum and in the earlier end of the hindgut, then you might just see some loose droppings. You get sort of slightly sloppy poo, but it could be a worst case scenario, a colic, or potentially an onset of laminitis if you had huge amounts of bacterial changes in that ecosystem.
No, that's helpful, thank you. And a term we often hear is the microbiome. What is that? Where do we even start?
Okay, so microbiome just means a collection of microbiota, and actually the microbiome in the horse, and we're talking about the gut microbiome. And there is definitely, there's an oral microbiome, there's the stomach, there's the hindgut, and we're generally talking about the hindgut. It's a little bit more focus on the stomach these days, but the hindgut tends to be our main focus. And so in there you've got bacteria, fungi, protozoa, and there's billions of them, and their job is they break down fibre. Well, that's one of their jobs. That's the thing that we usually focus on. So mammals don't produce cellulase, which is the enzyme needed to break down cellulose, which is in grass and hay and haylage and all those fibrous things. And so the microbes get a home and they produce the enzyme, and then they produce short chain fatty acids or volatile fatty acids for our horses. But what we're understanding more and more is they actually have the microbiome itself has lots of health benefits. So we can understand how diverse the microbiome is, and diversity appears to be consistent with health, and there are new studies looking at performance and all types of things that suggest if you have a more diverse microbiome, and that's usually linked to a more diverse diet, then you tend to be a more healthy individual. So there are lots of links to health and well-being, and I think we only really understand the surface of what the microbiome does. It's actually almost like a virtual organ in itself, but it's all kept in this back end area of the horse.
And so what effect can the digestive system have on our horse's behaviour?
There's a few elements that can link digestion to behaviour. So, I mean, on the simplest level, if we fed what I would call a more traditional diet, so a diet that has more cereal, more barley, maize, oats, etc., then depending on how those cereals are processed, they tend to be digested in the small intestine, and then you get a rapid blood glucose rise because the uptake comes from the small intestine, it's off into the bloodstream, and I usually liken that to a small child with a bag of sweets type scenario, and that's sometimes where we see more excitable behaviour in our horses. And there is a reason for that, because actually what happens is not only do you have that blood sugar rise, but actually it alters some of what's happening up in the brain. So where tryptophan uptake in the brain, it starts to increase when we have more insulin out to mop up that glucose that's in the bloodstream, and it makes more serotonin, which is the happy feel-good hormone. So actually sometimes when our horses are a bit excitable after that type of feed, it's because they've got that feel-good hormone. So that's one example, but we're starting to understand that there are links again with the gut and the brain that we term the gut-brain axis. And so we've seen from studies from rodents, and we've done some work ourselves with horses, whereby when we support the gut microbiome, and that can be with prebiotics and probiotics, actually that can have an influence on behaviour, much more subtly, but it may be that horses are more investigative in their behaviour and act in a slightly more natural way, or actually a little bit calmer in their behaviour, where there are some messaging that we don't really fully understand that come from the output from the hindgut that make it all the way up to the brain.
It's fascinating that all of this can be happening back here. We've got no idea, on a surface level what's happening, and the whole body is communicating, and it is dependent upon what they're eating.
Yeah, definitely. And I think it's the idea of if the gut microbiome is healthy, and actually for a horse a really important part of that is having fibre and forage as the mainstay of the diet, and it can be quite diverse, and that can link into horses actually grazing but also foraging, and when they're out in the field, or depending on what forage we feed them in the stable, that helps the diversity of the microbiome. And then the messages that are coming out of the microbiome are sort of fed up, whereas sometimes when the microbiome is not quite so diverse, or they're under a slightly more stressful situation, and that could be something as simple as clipping or travelling, all the normal things, but would be a little bit different, then they can get what we call leaky gut syndrome. So you get slightly more stressors coming out, and that sort of plays up in their behaviour. So they might seem either more alert or more subdued. And these are things that, again, we only really understand the very surface of them, but actually it makes a lot of sense when you think about it. We've got a good healthy gut and a good base diet, then actually the rest of the horse tends to function quite well.
Yeah, I've never heard the term leaky gut syndrome before. That was what you called
Yeah. So it's a human-based idea, and it's been studied in rodents, and the idea is that we have there are hormones and products that come from the microbes in the microbiome, and they feed out, and they feed up to the positive pathways up to the brain, but they can also, on a more negative perspective, they can leak out sort of pro-inflammatory factors, and that's the sort of the leaky gut element. So what we're actually aiming for is just the positive bit, and less so on the negative element.
No, that makes sense. And so for our day-to-day management, how can we promote healthy digestive systems within our horses, and how can we prevent conditions or gastric diseases that we might encounter, like colic?
Sure. So actually the Pony Club rules of feeding, there is some sense behind the make all of the changes gradually, because we already talked about how the horse, his gut microbiome is quite sensitive, and actually it is more sensitive than the rumen microbiome or our microbiome. They don't have a very large proportion of bacteria that can convert lactate into something useful, and lactate is produced when we get, say, too much of that cereal going back. So if we're going to make a change to the diet, and this really should also include our forage, then we should try and do it gradually. So the sort of 7 to 10 days, especially with concentrate feeds, is really important. But even if we're getting new batches of hay, it's important to try and do it to some extent gradually to make sure that the microbes get a chance to actually convert to using this new type of feed. Having fibre as the mainstay of the diet is really important, because that's what horses are designed to run on. Their teeth are designed to grind it. Their digestive system is designed to get as much out of fibre as possible. And we understand now that there are lots of types of fibres we can use in the diet, and we can use pre and probiotics to support the gut microbiome and also to help improve that digestibility. So trying to make the diet as fibre-based as possible is really important. That also means that there's a trickling effect into the stomach. And it is difficult, especially when you have horses that have to have restricted diets, but actually finding a way to trickle feed, because what we never really want is the stomach to be empty or empty for long periods of time, because that's where we get that acid splashing. So having a mat of fibre trickle through is really important. Keeping the starch content, so that the cereal-based content low. I mean, for a lot of horses, actually, fibre and a balancer is the perfect diet for a lot of them, and making the changes gradually. And those are really the key things to keeping the whole digestive tract healthy.
And am I right in saying that if you were, say for example, you have a horse who is prone to weight gain and you were putting them on some element of starvation, having those periods of time where they don't have access to food, that, you know, acid build-up in the stomach, are we, you know, allowing them to become more susceptible to ulcers and things like that?
Potentially. It's really difficult because horses only produce saliva when they chew. So they need to chew to produce the saliva, which helps to buffer the gastric juice. And while to some extent the stomach has stretch receptors, so when it stretches with food in there, it tells the body, okay, more secretions please, but it's still continually got some of that the acid pouring in. It's making that gastric juice. And actually, low stomach acid is important because it turns on one of the enzymes for digesting protein, from pepsinogen to pepsin, and it also stops any bugs and things getting further through. So we want the very base of the stomach to have quite a low pH. It's what it's designed to do. But what we want to try and do is trickle feed. So the sort of the small hold nets, the slow feeders, and trying to portion the diet out. There will be a portion of the day when they sleep, you know, so there's going to be a portion of the day where they're not eating so much, and we've got lots of video footage of watching horses, and they'll nibble during the night, so we want to have some food available, but trying to portion their ration out, and also thinking about ways that we can trickle feed and feed fibres that actually aren't particularly digestible. Okay. So if they have a slightly lower digestive, so if you have older hay that has a higher lignin content, it's less digestible, it's really hard work for the horse's digestive system to get the energy out. And so that can be a way, and there are lots of tricks that you can use, long soaking and all these types of things to try and reduce the calorie load so that you can keep the food trickling through.
And that's the thing, it's about keeping it all moving, keeping that access of food within the system, allowing that fibre and forage to work its way through.
Yes.
So the body can just keep functioning at its optimal level.
Yes, because the front end's quite quick. So I mean, you can have food, Bailey could be eating food and it could get to his hind gut within about 3 hours, but then it's about 36 hours that way onwards. It's quite slow, that end, but stomach emptying will depend on what the food is and if there's more food coming and various other things. But having a trickle through and then also making sure that there's lots of nice fibrous matter getting to the hind gut for that microbiome to work on.
And so I think the key messaging is to make sure that any adjustments that we're making to our horses' feeds, or you know, whether they're moving paddocks or having different hay cuts like you've said, is to make those gradual. And you know, we don't want to be bombarded, we don't want them to feel overwhelmed, we don't want them to suddenly have an upset stomach.
Yeah.
It's about doing those things progressively and allowing their body that time to adjust.
Just that, it's all about the gradual changes, and there have been lots of studies that have shown, for example, that horses are more likely to colic in the autumn when they've had grass, and then they're more stable based because the diet is drier. So it's just making those changes in a gradual way, make all the dietary changes gradual, and it just gives the digestive system and the microbiome a bit of time to just adapt to the new feed stuff, and then you tend to be fairly safe.
Perfect. Well, honestly, Simon, it's been fascinating hearing you talk about this. And we're lucky that we can even see it, you know, in motion and put sort of size to the test here? Because
There's a lot of anatomy. When you think about sitting on a horse, there's a lot of anatomy, and the gut takes up a huge amount of it underneath you.
No, thank you so much. It's been really interesting.
You're welcome.
Those were some brilliant conversations with Stuart and Simon. I really enjoyed learning about the way in which horses' teeth grow and then how that influences the way that the food passes through the horse's body. The key take-home messages for me are that we need to be feeding a forage-based diet, and that is going to be best for not only the horse's teeth, but also their internal digestive system. Secondly, we need to be having routine dental checks. Ideally, they should be every 6 to 12 months, and they can be carried out by a vet or a BAE DT. And finally, it sounds really simple, but the importance of making gradual changes to our horse's feed. We wouldn't change our diet dramatically just like that, so why would we do the same for our horse? Make those changes progressively and monitor the changes that take place, so then we know what is the normal for our horse, and we know that we are keeping their gut happy and healthy. If you enjoyed this video, make sure to click that like button, drop us a comment. I'd like to know what your key take-home messages were from this conversation. And finally, make sure you subscribe to our channel so that you don't miss out on the following episodes that are yet to come.